When COVID-19 was detected in 2019, the first virus variant was Wuhan, which was detected in China. The UVRI director, Professor Pontiano Kaleebu, says that over time, multiple variants of the virus that caused COVID-19 have been documented in South Africa, the UK, Brazil, among other countries.
As time went on, towards the end of 2020, the community, the scientists started seeing viruses that were different from the Wuhan. And in fact, the first variant that was described was the UK one, now called the Alpha, because there were a number of mutations, changes. Mutations would mean changes in the genetic composition of this virus.
Kaleebu says that early this year, a new variant was detected in West Nile region, Kitugumu and Amur districts, which mutated and caused a spike in cases requiring more attention given its rapid spread.
And we started seeing a strain that was quite unique. It had some mutations, a number of mutations, and it was called the A23, and then later the A23.1. And we described it. In fact, initially, globally, they used to call it the Uganda strain. And that virus became dominant. It took over from all the other strains. The A23.1, it was very common in Kampala.
In April, Kaleebu says the Indian variant had spread to Uganda.
The Indian is much more transmissible than even the UK one, the Alpha, and even much more transmissible than the original Wuhan.
The professor also answered the question on whether a person should first test for COVID-19 before getting the vaccine.
It does not mean that a vaccine will protect you 100%. But if it protects the majority, then that is worth taking it.
Kaleebu says findings show that the worst affected patients are those who have not been vaccinated.
In some of our groups, we see those who didn't receive the vaccine. We have more in hospitals and severe disease. Those who got one disease less, and one dose less. Those who got 2 doses, you can see a protection against severe disease and go into hospitals. So this, it is still small numbers we have looked at. But this also, if you add it to what others are reporting, I think AstraZeneca is still good in preventing severe disease and hospitalization.
Professor Kaleebu has asked the Ministry of Health to take an action on private facilities that have not been approved to handle COVID-19 testing because they may provide inaccurate results.
Testing is becoming an issue. We have made all efforts to open up to the private so that private labs can test. It is good for the country. We can provide more access, and we have provided opportunities for other health facilities to test. But it is also causing a big problem because private labs are now sometimes for money, for profit, and they're beginning to do things that are wrong.
In recent weeks, several cases have been reported and many people have lost their lives to coronavirus. Kamana Ivan Walnyolo, NTV Weekend Edition.